Hi guys, Dr. Lili here with my pocket pediatrician. Sorry I've been missing in action for a little while, but it's flu season and it's been super busy. Today I wanted to have the same conversation with you that I've had with a couple hundred of my patients in the last month or so. Hopefully you saw my flu shot video back in September and you all got your flu shots. But if your child has the flu, this is the video you need to watch.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
In general, we call it the flu when you're infected with the influenza virus. This is different than a stomach flu, and I do have a video about vomiting and diarrhea that you can check out as well if that's the issue that you're having. But if you're concerned about the flu, this is the place to be. Flu season generally starts in the fall and ends in the spring, with the peak months in the winter. From what I've been seeing in the pediatric emergency department, I really hope we're peaking right now. You can see here on this map from the CDC that most of the country is actually showing very high flu activity. They're also tracking the influenza-related hospitalizations, which are still on the rise. Last year, the 2017-2018 flu season was rough. It was the worst we've seen since 2009 with swine flu. About 49 million people were infected with the flu. That's more people than live in the entire state of Texas and Florida together. Unfortunately, almost 80,000 of them died. Can you imagine if something catastrophic happened at a Super Bowl stadium with over 70,000 fans present? It's unthinkable, yet more people than that died from the flu or its complications last year alone. About 185 of those deaths were children, but the CDC has a model showing that the actual number may be closer to 600 pediatric deaths. Now, if you're panicking right now because your child has the flu and you're frantically trying to divide 79,000 by 49 million, I'll do the math for you. Less than 0.2% of those who had the flu actually died from it. That's 0.2%. For the overwhelming majority, the flu is not a death sentence. So let's talk about what happens when most people get the flu. The most common symptom that people have when they have the flu is fever, usually higher than 101 degrees Fahrenheit or 38.3 degrees Celsius. They also can get chills and have body shaking. A lot of times they complain about headache, body aches, muscle pain. These kids are usually miserable. They also have sore throats, runny noses, cough, congestion, that kind of stuff. Sometimes they can have vomiting and diarrhea as well. In general, kids with the flu are miserable for about 5 to 7 days. They usually start with fever, and that usually lasts about 3 to 4 days, but the other symptoms can persist longer, and sometimes the cough lasts up to 2 weeks afterwards. We recommend acetaminophen and ibuprofen for the headaches, fevers, and body aches. I had one dad come in because his pharmacist told him he couldn't give the child ibuprofen on an empty stomach, but because the child had a fever, he wasn't eating. I had to explain to dad that yes, it's ideal, and if you're taking ibuprofen long term, you should try to take it with food. But in the case where a child has a fever and they're not going to eat, go ahead and give them the ibuprofen, and once they're feeling better, they'll start eating. You can give acetaminophen products every 4 hours, and you can give ibuprofen products every 6 hours. I usually recommend picking one and sticking with it, but if you have to alternate or one just doesn't break the fever, then make sure you write it down because it gets very confusing. And I've been up enough in the middle of the night with sick kids and being exhausted, you're not going to remember what you actually gave. What my husband and I do is we'll text each other if we give a child a medication. That way we both know what medicine each child was given and at what time so that we know when they're due for their next dose. Never give your child any aspirin products. These can be very dangerous for children. We also don't recommend any over-the-counter cough or cold medicines. The American Academy of Pediatrics recommends no cough or cold medicines, especially for children under 12. I do recommend getting your children to blow their noses as much as possible, or if they can't blow their nose, you need to suction it for them. The more boogers you get out of their nose, the less that are going to drip down the back of their throat that they're going to have to cough back up over and over and over. Make sure they're blowing or suctioning their noses before they eat and before bed. Also, for anybody who's over the age of 1, I recommend giving them teaspoons of honey to help reduce that irritation cough. You never want to give honey to a baby under 1, and I have another video about that if you're curious. But giving your child honey straight off the spoon will kind of coat the throat, reduce that irritation and urge to cough, but they still have their cough reflexes present if they need to, unlike some of those over-the-counter cough and cold medicines. It also doesn't have any of the dangerous side effects that those medications do, other than the sugar, so you might want to brush their teeth afterwards. Now, what about antiviral medications? As a pediatrician, I feel like I'm always saying it's just a virus, don't worry, your body's going to heal itself. But when people get the flu, all of a sudden everybody wants an antiviral medication. What antiviral medications do is they slow down the viral replication or reproduction. So when the virus goes in your body, the first thing it tries to do is reproduce itself. Antiviral medications can slow down this process if you give it to them right in the beginning of the flu infection. They don't actually cure the flu, but what they do is slow down the viral replication. Most studies show that they take off between 12 hours and 2 days of symptoms if you're infected with the flu, and you start taking them immediately at the onset of symptoms. There are 4 antiviral drugs currently approved to treat influenza. They are oseltamivir or Tamiflu, which is the most common one for children. With this medication, the most common side effects are nausea and vomiting, but there are other side effects as well. There have been a lot of articles going around about the neuropsychiatric side effects of Tamiflu. These might include hallucinations, staring episodes, odd behavior, or vivid dreams. If you read the FDA insert, it does say that these have been reported, but it's not clear if these are attributable to the Tamiflu or to the influenza infection itself. I can put the link down below in the comments, so if you want to take a look at that yourself, you're welcome to read it. The 3 other antivirals are zanamivir, peramivir, and baloxavir. These are used less commonly in kids, and I can honestly say I haven't personally prescribed these for anybody, but some doctors are using them. If your child has risk factors that would indicate they need to start an antiviral medication, you need to get your child to the doctor within the first 48 hours of symptoms for them to be able to get the medication started right away. These medications really only work when you start them right at the onset of illness. If you wait and the virus has already had a chance to replicate, they're really not going to do much good and you're still going to get all the side effects. So should your otherwise healthy child start an antiviral if they're already diagnosed with the flu? Probably not. We tend to only prescribe these medications to people who are more likely to develop complications. This would be kids with chronic illnesses like asthma, diabetes, heart disease, cancer, children under the age of 2, pregnant women, and then again people over 65, although that doesn't apply to pediatrics. These antivirals don't cure the flu, they just shorten the duration slightly, but they are supposed to help reduce the complications that can occur in those who are more likely to develop complications. So like I said, the vast majority of people recover from the flu just fine. The most common complications that occur in kids are ear infections and sinus infections, but there can be more serious complications as well. These would be things like pneumonia. Sometimes you can get inflammation or infection around the heart called myocarditis. You can also get it around the brain when it's called encephalitis. You can get a big inflammation in the muscles called myositis, or sometimes the flu causes multi-system organ failure, where it can affect your lungs, your kidneys, multiple organs, and it can cause the body to shut down and result in death. The flu can also trigger overwhelming sepsis in the body, which means the entire body just becomes infected and is fighting off the illness. Chronic medical conditions can also flare up with the flu. People with chronic medical conditions are much more likely to develop complications from the flu. The CDC suggests caution with children under 5, particularly with children under 2, and newborns are definitely at high risk. The CDC does recommend using antiviral treatments in people in those categories. Regardless of whether your child takes an antiviral medication, you need to watch your child for signs of complications if they've been diagnosed with the flu. Signs that complications are occurring would be heavy, fast, or hard breathing when they start using all their muscles in their chest to help them breathe and they're breathing really hard. Sometimes their nose will flare out like a bowl when they're trying to take a breath. You might see bluish color around the lips or on the face. Sometimes you can see them kind of pulling and you start to see spaces here just above the collarbone as well. You should bring them in for severe muscle pain that's not getting better when the fever's gone or not responding to ibuprofen or acetaminophen. Watch out for signs of dehydration, like going more than 8 hours without a wet diaper or without urinating. Look inside their mouth and see if the inside of the mouth is dry or they're not making tears when they're crying. Bring them in obviously for seizures or if they seem unresponsive or lethargic and they're not acting normally. Now when I say that, I don't mean that your child wants to curl up under a blanket and watch Paw Patrol for the day. I mean they're actually not responding correctly. They're just staring off into space, kind of listless looking. That would be a sign of lethargy. Or if you have any other concerns and you feel like your child's not acting right, it's probably a better idea to get them checked out. If your child is having trouble breathing, is dehydrated, or showing signs of what we call altered mental status, definitely get them checked out immediately. If your child has a fever, is kind of achy, and just sort of not eating well, but drinking okay, it's probably okay to curl up on the couch and just kind of ride it out. The flu is miserable. I remember getting it one year when I did get a shot, but the shot wasn't very effective. And I was lying in bed and I wanted a glass of water so badly, and my phone was there on the nightstand, not far from me, but I was having such bad body aches I couldn't even reach over to pick up my phone to text my husband and ask him to bring me up a glass of water. It's really miserable. You feel like you got hit by a truck. It's horrible. I understand that. It's miserable. It's highly contagious also. So make sure you're hand washing all the time. This is flu season, so just assume everybody you're encountering has the flu. Wash your hands, take precautions. Clean surfaces more often than you normally would in your home. And if you have a newborn or a medically fragile child, I would try to avoid public places during flu season if at all possible. When my babies were born in the wintertime, we watched church online, we avoided restaurants, we didn't go to indoor playgrounds, we just kind of hibernated for a little bit because I was just really worried about what was going to happen if one of our newborns got the flu. I also told people who wanted to come visit the babies that they needed to have a flu shot at least 2 weeks before they planned on visiting, just to make sure that they weren't putting my baby at risk. And whether or not you have anybody particularly vulnerable to the flu, your best bet is to get a shot early in the flu season before it starts and before you start getting exposed. I've had a lot of people ask me, is it too late for me to get one this year? The answer is, it probably would have been better to get it sooner, but we're still right in the peak of flu season right now, and while the shot takes about 2 weeks to become effective, it might be able to protect you. We probably still have a couple of months of flu season to get through, so I would think you'd probably get at least some protection over it. Now, if you get the shot and then you get the flu, don't go around saying, I got the flu from the flu shot. That's a myth. It doesn't happen. You just got the flu despite getting the flu shot because you got it too late. Even if you do get the flu, it will probably be a milder case because you got the shot. Finally, let's talk about one more fight I saw on Facebook this week. I saw a lot of moms arguing about when you can send your child back to school if they've been diagnosed with the flu. Now, as doctors, we usually say you should be fever-free for 24 hours without any medications before you send your child back to school. I've had a lot of parents admit to me, oh, my child had a fever this morning. I gave her some Motrin. The fever went down, so I sent her straight to school. And then, 4 to 6 hours later, the fever came back and school called and made me take her home. Don't do that. That's a terrible thing to do. Your child is the most contagious when they're having a fever. And I understand people have to work, but if your child has a fever, don't send them to school that day. So let's say my daughter gets a fever on Monday morning at 10 a.m. I give her some Motrin, and then I have to wait until 4 p.m. to start my 24-hour window. So if at 4 p.m. on Tuesday, she still doesn't have a fever, then I can send her back to school on Wednesday because she's been 24 hours without any medications working and didn't get a fever. Now, some people in this argument were saying, well, the CDC says that you can be contagious for 5 to 7 days, so you should just not send your kids to school for 5 to 7 days. That can be really hard on some families who are struggling to put food on the table. And yes, while that would be great in an ideal world, what if your child has no more symptoms? What if they have a milder case? They've been fever-free, they're not coughing, they're looking pretty good. I think you can send them back to school a little bit sooner. If you have the ability to keep them home as long as they're having any kind of symptom, that's great. Do that. I also understand you don't want people to be homeless because they lost their job because their kid had the flu and they have more than one kid and missed too much work. So what I would say is the bottom line is you absolutely should be fever-free for 24 hours without any fever medications. And you shouldn't have vomited in the last 24 hours. And obviously, if your child is kind of coughing up a lung, keep them home. But if they're looking pretty good and pretty much asymptomatic, it's okay to send them back to school. Now, I know how much fun it is to have bored sick kids at home. I have 4 kids and all 4 of them had a fever on a different day in the last week. And so I had to keep my older 2 home from school. And they were miserable and they did not want to be home. They were feeling fine. Each of them had a fever for just once or twice and then completely no other symptoms and felt wonderful. My 6-year-old was trying to tell me I was depriving him of his right to have an education by keeping him home. And I was like, no, buddy, sorry, you had a fever, that's it. We have to stay home for 24 hours. So he was not happy with me, but in the end, we turned it around and we had a pretty good day. Now, if you're keeping your kid home because they're sick, you also don't need to take them to Target or Walmart or the movies or anywhere else. If your child is sick, keep them out of public places because the whole point of it is to stop spreading these germs around. I will say that if you're a family that doesn't have a lot of time to take off to take care of sick kids, getting a flu shot early in the season is going to be a great idea for your family. So keep them home, keep them away, hand wash, all that kind of stuff. Avoid seeing newborns, anybody who would be more vulnerable to getting the flu. Basically, you're just going to have to ride it out unless you're suspicious that your child's developing complications, in which case you would need to talk to your doctor immediately or possibly go to the nearest ER. So I hope this has been helpful. I'd love to know what you've done when your kids had the flu, what worked for you, what didn't. Let me know what you think. Did you guys get a flu shot this year? Did you get the flu? How's everybody doing? I'd love to hear from you. Just comment below. Let me know what you think. I love hearing from you. And also don't forget to hit that little red subscribe button down there so you don't miss out on any new content. This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.